Now, let me get. So good evening, everyone. Welcome to the third of our series on Breast Cancer Awareness Month, part of the series on Care Should Not Wait. Today, we talk on living well after breast cancer. Because I think it is important to recognize that it's not something that's over and done with when we go through a treatment. And often people live for long periods with issues or with concerns or with psychological issues as well. We are very privileged to have with us Dr. Shruti Kate, who is a medical oncologist at HCG Manavta Cancer Center in Nashik. And we've got Dr. Rakesh Reddy Boya, who's consultant medical oncology and hemat oncologist at Mahatma Gandhi Cancer Hospital, Visakhapatnam. Quick reminder, Patients Engage is an online platform for patients dealing with chronic diseases, and it allows them as well as their caregivers to share personal experiences and information that they've learned through their journey and through their experiences. The information we provide is always moderated and made sure that it's evidence-based, and the intent is to allow critical decision-making to be easier and for people to not feel alone. So those are the two critical aspects of our platform. Some of the content which we've done in the past, where we've put patients and caregivers at the center, where we've talked of relationship that they have with their children or body image issues, especially around breast cancer and some other forms of cancer, and about getting fit after breast cancers. And you can find all of this content on our YouTube channel as well. Plus, in the last week, we have done, two other sessions on The Cancer Does Not Wait. We spoke about signs and symptoms and risks of breast cancer, as well as we spoke on navigating the treatment phase of breast cancer yesterday. And both these you will find both on our Facebook page as well as our YouTube channel. Again, a quick reminder, we are talking today to Dr. Shruti Kate and Dr. Rakesh Reddy, and I am Aparna Mittal. I'm the founder of Patients Engage. This session is being supported by Pfizer in interest of information and awareness for the public, and it's not a substitute for medical advice. So do consult your doctor for guidance on the information that you need or whatever you get from this. And the views expressed in this are of the speaker, and they may not represent the views of Pfizer or of the platform. And as always, you can post your questions on Zoom if you're logged in here, or on Facebook and YouTube. And you can reach us on our social media profile as well as on the website www.patientsengage.com. So let's get started. We have with us a whole bunch of questions which we've already received. Dr. Rakesh, we'll start with you. What is the typical follow-up routine for patients after the period of intensive treatment is over?
Yeah, so this intensive treatment period would last about maybe 6 months to a year. And after that, the follow-up is equally important. So suppose if the patient is in remission, like the patient is completely cured of breast cancer, like we had an early breast cancer, the typical follow-up routine would be more close by in first 2 years, where the risk of recurrence is the maximum. So I would typically see these patients once in every 3 months. And the third year will be once in about maybe 4 months. Fourth and fifth year, once in every 6 months. And after fifth year, maybe once in a year is appropriate for follow-up of various aspects that we see in follow-up.
And Dr. Shruti, in this follow-up, typically, what are the things that you're checking for, and what should the patients come prepared as far as the follow-up is concerned?
Yeah, so the follow-up includes history taking and general physical examination and detailed breast examination. So like Dr. Rakesh also mentioned, we do it every 3 to 6 monthly for the first 2 to 3 years. So examination and history taking is there in every visit, but we do not insist on any investigations. We do a bilateral mammography or a unilateral mammography depending on what kind of surgery has been done, and that we do it once a year. So only if the history and the examination leads us to anything in particular, then we ask for specific tests like a chest x-ray or a sonography of the abdomen, or for that matter PET CT or CT, if there's anything that we find or we want to confirm. Apart from if not, if everything is fine, we just do a manual examination. That's it.
Right. In terms of the reason I'm also asking is that there are often long-term effects that happen because of either the cancer itself or the treatment. So, again, Dr. Reddy, what are some of the long-term effects that survivors should be aware of?
Yeah. So one thing is the most common side effect that the patients complain of is lymphedema. The swelling of the arm on the side of the breast cancer treatment. It might not limit to upper arm itself. It can go until the fingers. It can involve the neck and the upper chest as well. So this is something that is frequently there and frequently complained of. We do recommend certain maneuvers like physiotherapy and routine physiotherapy exercises that are taught to the patient at the time of surgery itself, in the post-surgery care also. So that needs to be continued, and that is something that we advise the patient in every visit regarding not taking a BP measurement on the same side, not getting venipunctures or blood sampling on the same side of the breast cancer treatment. Apart from this lymphedema, we do see certain other long-term side effects. Some of them are related to psychological well-being of the patient. Very frequently, we see patient getting tensed up at the time of whenever the next visit is approaching. They have this sleeplessness and sleepless nights, wondering what they might hear from their doctor at the next visit, what might befall in there. So they're never free. They are never free of this psychological stress that cancer recurrence might happen. So that psychological effect would be there. There could be some memory related issues. There is some chronic fatigue that we keep observing in these patients, that they do complain that their energy levels are lower. And apart from this, these things that are mostly psychological rather than physical, there could be some other side effects of treatment itself, like some cardiac side effects, some early occurrence of menopause. Like if a patient who is 40-year-old, who is expected to get menopause at 50 years, because of the treatment, they attain early menopause. So they will suffer from early menopausal symptoms. It could be hot flashes. It could be fatigue
osteoporosis.
or osteoporosis. The bone health is a big issue in itself. So the menopausal symptoms, they could also be a significant part. Sexual health takes an impact. So these are all the long-term side effects that I would personally want the patient to be a diabetic check or their BP check. They can be earlier in onset after treatment.
Right. Thank you. I think you brought up the point that because of the surgery, they are supposed to not take blood pressure on one arm, or on the arm which has been affected. But what if somebody's had breast cancer which has affected both sides, right? So then what are they supposed to do?
Can I go ahead with that?
Yeah, go ahead.
Yeah. So you can still take a lower limb blood pressure. The idea is, it is not a hard and fast rule that you should not be taking. This is some general guidance only. There would be some difference in, like, let's say if a patient gets a left breast surgery and a left arm lymphedema is there. There would be some difference in the blood pressure that is taken from the left and right, but it is not a hard and fast rule. Suppose if they had both surgeries, they can still go ahead. It is like a baseline measurement, and subsequent, it is not one single measurement that we are going to jump in and ask, no, you got a BP now, hypertensive record now, we are going to treat you now itself. It is something that will serve as a baseline, and subsequent follow-ups will be on that baseline. So we can still have a baseline recording for that matter in any of the arm. It is just a general guidance what we give to the patient, not something that we stick hard and fast to.
Right. Thank you. Because I think patients do get confused about these things. So we just wanted to make sure. Dr. Shruti, we talked of some of these effects, and Dr. Rakesh alluded to fertility and sexual health. Can you talk a little bit more on how that affects women and including the body image issues that come up?
Yeah. So what he touched upon was early onset of menopause. That is very, very disturbing, concerning, issue with these patients. That not only affects them psychologically, but it does affect their bones, and there is an accelerated onset of osteoporosis and joint issues. So many of those hormonal treatments cause skeletal symptoms, pain, and all that. So that is another issue, and it is important for us to keep checking their calcium, vitamin D levels, guide them properly if they are developing osteopenia, so that they don't progress to osteoporosis, because then the risk of fracture increases with trivial trauma. So you've just slipped but you've developed a fracture, so that may happen if the bones are very weak. So that's why the guidelines don't say check all these things on an yearly basis or something, but case to case basis we make it a point that at least that bone health assessment should be done, and especially those who have been advised drugs which impact the bone health. A baseline bone scan, a bone densitometry scan is required, which assesses the mineralization of the bone and use it for future reference. So that is also important. Those are not general guidelines, but you have to individualize. Then many of our patients, especially Indian patients, are very young. So someone who is 35-year-old, less than 40-year-old, may develop an ovulation failure. That is also an issue. The patient has not attained menopause but is unable to ovulate. So all those things have impact on the fertility. Even not getting menses creates a lot of issue with these patients, and they continuously keep feeling that there's something wrong. So a gynecological evaluation, hormonal tests, and it was also important to look at the disease profile, what it was it a hormone positive disease or negative disease, and the patients who have not completed family, guiding them properly to a successful conception and delivery. So we will maybe talk about it in greater detail, but that is very much possible. And many of these patients get scared that now they cannot have a child, or a normal delivery is not possible, normal pregnancy is not possible. But there is very many data which is available, very many research papers that are available, which have said that this does not impact your successful pregnancy and conception, as well as pregnancy, as well as the outcome of the newborn which is there, when it is done properly, in proper guidance, with proper stoppage of drugs which are not supposed to be taken when the patient conceives. So all those things are also important. And for younger patients, we all should give that due importance. As soon as the treatment is over, at the first visit we guide them, we talk about it in a brief sort of a setting, but we don't want to make them anxious about the future.
Right.
I want to tell them a lot, what side effects may happen in the long term or something. But as they, complete their treatment, it's important to guide them regarding that aspect as well, so that, they gradually know how to take care of themselves, because, the entire body is recovering from the disease and the trauma of the treatment as well.
Right. So 2 points on that, right? One, I would expect that this discussion should actually happen before starting any treatment, because, there are options like fertility preservation and so on as well, right? So it should ideally be before the treatment starts and not later. And the second thing, I think we have heard patients talk about dryness in vagina and so on as well because of the treatment, also which affects sexual health, plus the whole body image and how they perceive themselves because of the scars that they face. So what kind of support should be made available to these patients?
So regarding the fertility issues, is very much important to discuss that point for a younger patient, because you want to know what the patient wants.
Correct.
And you can offer preservation. I was talking about the ovulation failure. So
Right. Okay.
Of course, fertility preservation, the treatment, begins before the first dose of chemotherapy. So of course, and we the gynecologist and the infertility expert also in the loop, and we actually ask the couple to visit them once, so as to have an idea of the entire process. And thankfully the technology has become so advanced that everything is at the disposal now. Dyspareunia due to vaginal dryness is a big issue. It happens for all the women. Even during chemotherapy, because of the decline in the hormone levels, and plus if the patient has attained early onset menopause again. So unfortunately for hormone positive patients, we cannot give hormonal treatments for this problem, and we have to actually counsel them, ask them to use lubricants and all, and we have to tell them that it's because of what, we have to explain them so that anxiety,
it doesn't come as a surprise, and because it's not something that people talk about so easily, right? They don't know that. Yeah. So
yes. So many a times it's a taboo to talk about the sexual health, and even the males, would talk only when the female counterpart is not there.
Right.
So about the female talking in front of the spouse. So it is still there, but yes, people have started opening up about it. They ask, they are open to the suggestions as well as the tips that we give them, so that because many a times the first thing that comes to their mind is that this is something that is permanent, is not going to go away. But we have to tell them that it is gradually it is going to become better as the you go further away from the treatment part of it. So
right. Thank you. I think, doctor, you talked of scanxiety. I think there's a term for it actually that the breast cancers or cancer survivors have talked of, where when you approach your periodic testing, you're worried about what the result will be, and it's actually called scanxiety. But what I wanted to understand was, can they do anything to prevent recurrence or relapse? That's the question that often they have, that what can I do to prevent a recurrence or a relapse?
Okay. So to avoid scanxiety, first is to avoid scans. So that is one thing that I actually do actively a lot, because even when the patient herself is very anxious, there will be family members who would want to be on top of the disease, like we want a PET scan once in every 6 months. So right. I tell them very clearly that have you seen any changes in the preceding 3 days or 4 days in your patient before bringing? They would definitely, invariably I get a feedback that she was not sleeping well. She's getting more anxious. She's getting more. So this is very real. Even their patients are very, they dread the time that they have to come back. So Correct. They really know that their month of, follow-up has approached, and they would be dreading the visit too. So that we have to definitely recognize. And as Dr. Shruti has mentioned previously in the discussion, there is no regular scans that we do. Once yearly mammogram is something that we try to stick to. But again, I will still put the patient's comfort as precedence over this mammogram, pushing for an yearly mammogram. If they're really worried, if they seem that really don't look like doing well psychologically with that, I will put it in the back seat, and I will rather rely on a good physical examination, talking to the patient about their psychological stressors. Regarding the risk of recurrence, what can they do to reduce the risk of recurrence? First and foremost is to follow the entire duration of treatment. Like, for example, if you take a hormonal therapy of hormonal adjuvant therapy, the duration is 5 years, 5 years of taking a pill day in and day out. So that itself is not an easy thing. And now the guidelines are suggesting 7 years and 10 years in certain instances. So this long duration of treatment needs to be adhered to. Patient needs to make themselves mentally ready to take the drugs for as long, because these are simple interventions. These are not difficult interventions. They are not costly. They don't put a lot of strain on your body in terms of side effects. And this is probably the most important thing to do, to decrease recurrence. Another important thing is to understand the biology of your disease. Okay, you have different types of breast cancer. Not all breast cancers are same. So we have hormone receptor positive breast cancers, we have triple negative breast cancers, we have HER2 positive breast cancers. The understanding is simple. If you have a triple negative breast cancer, if you are through the first 3 years of follow-up, usually you don't have a recurrence. For a hormone positive breast cancer, you have to understand and recognize the fact that the recurrence can happen as long as 10 years and 15 years. So it is important to stick to the treatment advice, the follow-up advice that the doctor is giving you. Another is, if there is any risk of family hereditary cancer that is there with the given phenotype of your presentation, understand that risk, discuss that with your doctor, and listen to the test that he is going to suggest, he or she is going to suggest, and adhere to the treatment protocol accordingly, because certain interventions at that point will also reduce the recurrence. Apart from this, there is a whole lot of things of diet modification and exercise and yoga and physical well-mindedness, and all these things also play at least a certain bit of role, not a quantifiable role, but I would say that there is at least certain bit of role in them in terms of reducing the recurrence and making the patient feel better in the years that they are going to live.
Right. Thank you. Dr. Shruti, Dr. Rakesh talked of diet and exercise and yoga. Can you, tell us what you advise patients to do as far as that is concerned? Because you have two types of patients, right? Or maybe a whole spectrum of them. So there'll be those who will try and follow every possible diet or regimen for preventing it. There'll be others who'll say none of this makes a difference and not bother to do anything. And then there's the whole set in between who'll try different things for a bit of time but not sustain and so on. So what is your advice to such patients?
Yeah, so I totally agree. And then the other lot, the one who doesn't follow regularly, I would say, when they ask what we can do to, prevent something, unfortunate to happen, regular follow-up is very important. And many a times they have a feeling that if we don't have any symptom, why to go for a regular visit? So and many a times such defaulters would actually come with complaints ki, we are feeling pain in the breast or any part of the body for the past 3 days. So then they come. So it's important to emphasize in every visit that this is a regular follow-up which you have to come, which you have to attend, and if there is any problem in between, of course you have to come. So this part also is important, and the caregiver also should be made to understand this, that follow-ups are very important. Many a times a subtle thing that is picked up on a follow-up may get missed, and then there's a progression of the disease which actually closes many doors of treatment. So it is important from that point of view. And regarding the diet and exercise, like Dr. Rakesh also said, that the role is less if you talk about the quantity of benefit that it gives, but overall it is very important to ensure a proper diet, exercise, sleep cycle in these patients to allay the anxiety levels and for the general well-being. So once their diet is healthy, balanced, which includes proteins, carbohydrates, fruits, vegetables, and cereals, pulses, everything in the right quantity, that is in itself is going to give proper signals to the body for the hunger, as well as keep unnecessarily junk eating to a limit. Plus if you incorporate exercise in your everyday routine, we know that as doctors also how important it is to incorporate that into your lifestyle to ensure that you are happy the entire day. So both these things together with a good amount of sleep is going to help you lead a better life, which in general also affects you in many ways, because there are very complex family issues which come up once a person in the family is diagnosed with breast cancer in particular, because it is still associated with the stigma. Many times the woman would tell us that my daughter is supposed to get married, so
Yeah.
I want to delay the chemo, I don't want anyone to know, because uh, there's no logic to it, but she just wouldn't want to, so they don't want to reveal it, so the entire family is disturbed. And then there are pressures which are sometimes known or unknown, due to the society stigma. So all these things are important. From that aspect, we need to inculcate a confidence level in the patient, so that she actually educates her family about what breast cancer is, and spreads that awareness in the circle that she is moving, so that if there is a breast lump in any lady, she comes up immediately and tells. So the problem is that they don't want to reveal that there is something abnormal with this part of the body. So we are still fighting for that level of awareness, and the patients, actually, I mean, I'm still finding a patient who would just come to the OPD with a breast lump which she has identified yesterday or today. Then the closest that I've come is 1 week maybe. So it's that is also an issue. So survivors need to come forward and proudly say that they are survivors, because it's a big thing. You are winners. So that is still not happening to a large extent.
Right. Thank you. Dr. Rakesh, a couple of questions. I think you talked of family history, etc. But can genetic testing help in assessing the risk of recurrence
Most
of breast
definitely,
cancer?
yes. Yeah. There are certain cancers which are specifically associated with a risk of hereditary cancer. So we have to understand what this hereditary cancer means, where there is a risk of the subsequent progeny or the first degree relatives of the patient to have a very high risk of acquiring cancers in their lifetime. Like, for example, if you compare them with the general population, if their risk of recurrence is more than 10 to 20 times, then they would probably be having what is called as a hereditary cancer syndrome. So breast cancer is associated with a very famous hereditary cancer syndrome called BRCA or BRCA. So we have to understand certain things about BRCA. So not every breast cancer is associated with BRCA and associated with the hereditary cancer risk. So if you take a breast cancer, I mean, there is, of all the about 100 breast cancers, the chances of it being hereditary is about 5 to 10%. About 90 to 95% of breast cancers will not be associated with the hereditary cancer syndrome. So just because you had a diagnosis of breast cancer syndrome, just don't jump thinking that my daughter will develop or my sister will develop. So that is very important to understand. So 5 to 10%, it is a low number, but not a minuscule one. How do we identify this subset of hereditary breast cancers is, one, they will be earlier in age of onset. There will be multiple members in your family who would have developed a breast cancer. There would be some specific subtypes like triple negative breast cancer. There could be some bunching of different type of cancers like breast cancer and ovarian cancer in the same family, breast cancer and pancreatic cancer and prostate cancer in the same family. Male breast cancer, if you have a first degree relative with male breast cancer, it is a very significant significant risk factor for BRCA. So these are some guidelines that are developed for certain types of these types of phenotypes, which we recognize and advise this particular testing. Even before testing, it is very important for the patient to understand what test is being done. And so a pre-test genetic counseling is important, because we might have a positive test which will have its own implication, a negative test which might have some implications of unnecessary false sense of security in the patient. And there can be something in between called an uncertain significance report. So we have to make the patient understand, the family understand. Sometimes the children wouldn't want to get these tests, and we have to respect their wishes. So a family counseling, pre-test counseling is important. So the just to simplify it, not all breast cancers are hereditary cancers. About 5 to 10% are, and it is important to understand and recognize which they are. So discuss with your doctor. So if you as a breast cancer patient need to undergo a genetic test, it is a small, simple blood test. It is nothing that is new biopsy is being done, or hi-fi test is being done. There's 3 to 5 ml of blood sample will be taken. We have pretty good number of labs that are offering this test. Pretty good sensitive technology is available now. And once it is identified, some treatment schema will come into picture at that particular point of time.
And the recurrence, I think you said, okay, in terms of recurrence itself, the recurrence could be in the second breast, or it could be on other organs.
Very true. So if you have a BRCA mutation, if you have already a primary diagnosis of breast cancer, so this is after the initial stabilization of the patient, during the initial 1-2 months of treatment, I don't broach this subject immediately at the time of diagnosis, just not to scare the patient too much. Already there will be a lot of psychological stress at that particular point of time. Some patients do indeed come prepared, and they read a whole lot of material that is available online. So after about a month or two, I do broach this subject with the family. I discuss with them, get the test done, and this will have an impact right at that initial treatment itself. What kind of treatment are we going to offer? Like if the patient has a left breast primary cancer, what are we going to do with the right breast? Because it is well understood that the right breast also has an increased risk of cancer if there is a BRCA mutation. It is also understood that there is an increased risk of ovarian cancer in the same family member, in the same patient. So what I would typically do is I have quite a good number of patients like that, where I have offered right at the time of after the initial chemotherapy, when the time for the breast surgery comes, an ovarian removal at that same point of time, because that would prevent an ovary cancer on almost more than 90% of time. It would also prevent a significant number of recurrences in the other breast as well. So instead of going for a bilateral mastectomy, which will have a lot of body image issues, as you already mentioned, this is one thing that can be done as an in-between thing. Again, I put all the options in front of the patient, wait them to take the decision at that point of time. But your point is very well made, that this indeed has an increased risk of recurrence in the opposite breast as well as in the other organs, ovary specifically.
Right. Thank you. And Dr. Shruti, you talked of, how people are not yet coming forward to talk about it. And I guess to some extent, we are seeing a difference in smaller towns versus the metros. I think we have seen more breast cancer patients stepping out and talking about their experience in metros. But if you look at it from, the cities like Nashik, where you stay and practice, is that because of stigma, or is that lack of, that the fact that they need more emotional and psychological support? What do you think are the needs there that we should be talking about and addressing?
Aparna, the issues related to this is are very complex, because first thing is that it comes with a guilt, that I have something wrong with my body. That is why I have developed breast cancer. Even for that matter, Dr. Rakesh very much emphasized on the pre-testing counseling, because just telling the person that there could be a blood abnormality, that's why you have developed breast cancer, you may develop some other cancers in the future, you can just go home and sleep. So it's not possible. So it has to be conveyed in a very scientific way, and how it is going to be utilized for the betterment of you as well as your family. So that is there. So I think people don't come up because of the same reason. They think that there'll be a lot of fault finding in the family. Then many times, people are not financially sound, and then there's shoving of responsibility between the two sides of the couple, and it's like that. And then the anxiety. So anxiety, I mean, like if we go to the doctor, we may get breast cancer. If it is there for 6 months, it's fine. But if the doctor, sees it,
they'll confirm it, right?
that it will become breast cancer. So,
Yeah.
but I totally agree with you that the times are changing, even in cities like Nashik, and so many, we cater to the adjoining rural area as well. And very many people now have access to good health care, and there is a sense of, I mean, they're accepting, that cancer is also like any other chronic disease. So
right.
We need to get a treatment for hypertension, diabetes, and cancer. It's like that. So I guess more and more survivors are going to spread this message in a positive way, and we should, engage the survivors in whatever way possible. They just need a platform, maybe. And there are many people who are out there willing to help. So we need to give them some voice and platform.
So yeah, we do, our platform does give the voice.
Yes,
so if you do have patients who would like to speak, please, they can reach out to us. A couple of quick questions, Dr. Shruti. One question that we've got is, if you've had mastectomy, there is no risk of recurrence, true or false?
It's not like that. Both the surgeries are equivalent in terms of their long-term outcomes. Actually, there are some papers where it was inferred that, or concluded that, conservation surgeries, people are living longer, or patients are living longer with conservation surgeries, because, and maybe the reason is that they compulsorily received radiation, so which may have an long-term implication of the overall survival, because the techniques are better now. So the rule for the surgeons, the bigger the better, is changing, and actually they are going towards smaller surgery, smaller incisions and everything. So it's nothing like that if you have done mastectomy, you should just get relieved. And this false sense of security is actually very, very dangerous, like Rakesh also mentioned. It is all about the biology of your disease.
Right. Okay. Dr. Rakesh, you talked of, people needing to take the hormone therapy or targeted therapy for 5 years, 7 years, whatever. What happens if they miss a dose? Are they supposed to, and this is something that, again, I know for things like diabetes, people know what to do, but for things like this, sometimes they're not sure that, okay, I've missed it for a week now. So then I'm too scared to go back to the doctor and say I missed it for a week, and then I don't go back at all, right? So what is the advice as doctors that you would want to give?
We have come to realize and accept that it is very real. It is something that happens, and people, I mean, they are scared. And I do ask them quite a number of times, if you have missed one day, if you have missed 5 days, and I will be very gentle about it. I will not sit on their head and say that, no, you have done this wrong, because it is very difficult to be taking a drug day in and day out. There are some people who take an aid of smartphone, and they have these reminders of take a pill at 6 o'clock or 7 o'clock.
Correct.
If they can do it, I do suggest them to take an aid of smartphone in that way. But if there is a dose missed, I would tell them not to take 2 tablets the next day. That is one thing that I would say. So it is something that once you are gentle with them, they do hear. And I mean, I have come to realize that they listen to your words with such rapt attention, and they love you and fear you at the same time.
Correct.
Yeah, this is something that I mean, we consider it as a boon, and we are there for you. I tell them that it is not easy to be taking a drug daily for 5 years or 6 years or 7 years. If they are doing something that is if for example, somebody might be having a financial issue of paying 1,000 rupees per month for a tablet, so even that has to be explored. You cannot take for granted that patient will be able to explore, be doing that very easily. So I do ask them if they have financial hardships, and it is very easy to bridge that as well. To be able to help a patient with 1,000 rupees medication per month is not a big deal at all. With the kind of resources and the support platforms like yourself, there are a lot of
There are.
platforms like you. So just get the patients in connect with them, and they will be able to help. So I mean, just
and the other
identify.
follow-up question on that
Yes.
is if they've missed it because they're unwell for something, right? So the sick
Yes.
day concept as well.
Yes. So usually these drugs, they don't have much of interactions. They don't have. I mean, some drugs do have, majority they don't. So there is not such like they have to undergo a surgical procedure or a dental
Right.
extraction, and they
Right.
have to keep away the drug for 5 days. There is no such recommendation like that. They can keep taking these drugs even during any subsequent procedures, medical procedures they might need to undergo. So that's about it.
Okay.
Can safely continue. Yes.
All right. Thank you. Thank you so much. I think you've answered a lot of questions which we typically don't cover in a lot of these discussions. Final words from both of you, Dr. Shruti. Any final message to the audience that is watching?
Yes, so I just want to very briefly tell the patients who are listening that this is just a phase of life. The treatment will get over. You will be a winner for sure. And it is very important to stick to the.
I think we have lost Dr. Shruti a little bit. Okay. Dr. Rakesh.
Yeah, so this is specifically to a few of my patients who I'm sure must have tuned in.
Right.
Yeah, you might come across me as little harsh sometimes, but I do love you. And be a thriver, not a survivor. You have done much more than that. You have done what 99 people, I mean, percent of people around you must not have faced in their lifetime. So you truly are a winner. So don't just be a survivor, be a thriver, and make sure that whenever you see a patient who is going through the hardship, make sure that you are there for them. Form a support group or form a survivorship. Write about your, journey. Don't see it as a struggle. It is a journey. Don't see it as a struggle, and speak about it. Write about it. Don't be afraid of it. And certainly nothing to be ashamed of. And I'm so glad that we could connect like this. Thank you for the opportunity.
Sorry, thank you, Dr. Reddy. One question that's just come in from somebody. There's a 74-year-old lady who's not convinced about hormone therapy. I think it's quite specific, but especially as she's just marginally positive. Anything that you would like to say?
Yeah, so marginally positive hormone receptor status does exist, and you will be benefited by hormone therapy. If you are in doubt of the report, maybe you can get it checked at another laboratory just to have a confirmation that it indeed is hormone positive. And don't be afraid, 74 years hormone receptor therapy can be given with good due diligence being given to your bone health, and certainly not a thing that you need to be afraid of.
Thank you. Thank you. Dr. Shruti, you were cut off a little last time. Do you want to finish what you were saying? Or you were done when you were giving your final message to the audience?
My message was carried forward by Rakesh, and he actually, I don't know how, but he stole all my lines.
So clearly you all are both in sync. Thank you so much, Dr. Shruti and Dr. Rakesh, for your time. And thank you to our audience for listening in. And please do stay motivated after your breast cancer as well. And as a lot of people say that it's just a page in the book. So, carry on. Thank you so much, everyone.